everyone. I'm Dr. Sabya Kulshrestha, and I warmly welcome you all to today's webinar, Visceral Fat Decoded, Your Key to Diabetes Prevention. As we celebrate Children's Day, it becomes even more meaningful to reflect on the choices we make. Choices that shape not just our health, but the health of the generations that follow. And today also marks World Diabetes Day, reminding us how crucial awareness is in preventing a condition that touches millions of lives. Many of us think of fat as what we see on the surface, but the most dangerous fat is the one we cannot see, which is the visceral fat, the hidden fat stored deep inside the abdomen, wrapped around vital organs. It silently releases harmful chemicals, disrupts insulin function, alters metabolism, and sets the stage for type 2 diabetes long before visible symptoms appear. This is why even individuals who look physically fit may still be at risk. What experts call the TOFI effect, thin outside, fat inside. The good news is that visceral fat is modifiable and reversible. Through simple, sustainable lifestyle habits like mindful eating, physical activity, restful sleep, and stress management, we can dramatically reduce the impact and protect our term health. I would like to inform you all that we are live from our official LinkedIn page of Health Parliament with over 29,000 healthcare leaders. Today, we're honored to be joined by two distinguished leaders in the field. Dr. Rajendra Pratap Gupta, founder of Health Parliament and International Patients Union, a global leader in digital health and public policy. Dr. Gupta has worked with governments and multilateral organizations, authored 5 influential books, including the global bestseller Digital Health Truly Transformational, and delivered over 300 talks worldwide. He leads 3 dynamic coalitions at the United Nations Internet Governance Forum and serves on the board of the International Society for Telemedicine and E-Health. He's also the chairman of Commonwealth AI Consortium Capacity Building. Welcome, sir.
Thank you,
And
Sabya.
then we have Dr. Sanjay Shah, who's the director, Swami Vivekanand Health Mission Society's Haridwar Hospital, chairman, Association of Physicians of India, Uttarakhand, past chairman of RSSDI Uttarakhand. He's a renowned consultant physician and diabetologist, known for his contributions to advancing diabetes care. He's represented India at several national and international forums, including the American College of Physicians India chapter meeting in 2022. Before we move into the technical discussions, it is my honor to invite Dr. Gupta to open the session and share the idea behind organizing this important webinar. Sir, over to you.
Okay, thank you, Dr. Sanjay Shah and Sabya and the team Health Parliament. While today is International Diabetes Day, every day is a diabetes prevention day if we are mindful, not stomachful in what we do. Having said that, I see there are a lot of misconceptions around diabetes first and what causes and what it leads to. Today is a time of Instagram reels. So you get so fancy reels, that you get moved by the solutions that you are given or by the information you get to understand that everything can be back to normal again and you don't need to worry. You can have your sweets, you can have your rice, you can have everything. Sometimes this information overload worries me. But we are lucky that we have people, like Dr. Sanjay Shah, who are committed to creating awareness, education, and telling people about the facts about what is diabetes, what causes it, and how you can remit it. I mean, like, he also runs the very good remission program for diabetes. So in fact, I'm lucky that we have well-wishers like him. And we hope that you will learn from what he tells you, implement in your daily routine and life, and not just wait for the World Diabetes Day, but try to make it every day like your Diabetes Prevention Day. Well, thank you so much, and I will pass it on to the person whom we are waiting to listen to. Thank you.
Thank you so much, sir, for setting the direction for today's session. Now I would like to invite Dr. Sanjay Shah to begin his presentation.
Good evening, everybody, and thank you, Dr. Rajendra Pratap, for once again starting such an interesting discussion on this very important day, International Diabetes Day. And like he very rightly said, that for us, every day is a diabetes prevention day. And the problem now is so much so that we are more into searching and looking for pre-diabetic people. So if a diabetic patient comes to us, then we make sure that none of the family members are pre-diabetic. And believe you me, most of them are pre-diabetic and most of them didn't even know that they are pre-diabetic. So the problem, like Dr. Rajan said, is a global problem, especially for us here in Southeast Asia, where, like you mentioned, that from outside we'll be thin, and then also you'll ask us that I don't have that much of fat like my neighbor. He eats everything, and why do I have such high blood glucose levels? Why am I type 2 diabetic? So there are other factors apart from your the fat that you pinch. We also have fat that you cannot pinch. That is what we call the visceral fat. And prevention is the key. As in all metabolic disorders, if your lifestyle is all right, and if you have appropriate and adequate lifestyle modifications, you follow a healthy diet, a proper schedule, and like your ancestors, you can lead a healthy life till the age of 100 and beyond. That was, I think, a talk that I gave recently to a lot of PhD students. They were all doctors, but all PhDs. And there was this International Environment Society meeting, and they told me to speak on diabetes. I said, when there are no medicos here, it is better that I talk about Sat Ayu Bhava. That was how to live for 100 years and beyond. So that was a recent presentation. Today we'll be talking more on the hidden fat. So I will share my slide. Is it visible?
Yes.
So the topic that we are going to discuss today, apart from prevention, is visceral fat decoded, the key to diabetes prevention. So we all think about body fat, but what if I told you that the most dangerous fat in your body is the one that you can't even see? So, in the next few minutes, we are going to decode the hidden fat called visceral fat and discover why it's the number one target for preventing type 2 diabetes. So, not all fat is created equal. You have subcutaneous adipose tissue, SAD, the pinchable fat, which I just mentioned, which is located just under the skin and which you can see from a distance also. And then we have the visceral adipose tissue, VAD, that is a metabolically active fat. It is deeply stored. It also surrounds vital organs like the liver, the pancreas, and the intestines. And we are talking about visceral fat. This is the deep internal fat that wraps around our vital organs, and we can't see it, you can't pinch it, but it's a metabolically active fat, uh, and unfortunately, it's a factory of all possible problems. So, looking at the image in the middle, what you're seeing are DEXA scans. They are advanced scans that precisely measure bone, muscle, and fat. The gold standard for measuring and analyzing visceral fat, comprising MRIs and computed tomographies, that is CT scans. And when we look at body weight, it lumps everything together, but DEXA allows us to see the composite of that weight. The blue is bone that you can see very clearly. The red is muscle, And the yellow and orange areas, they represent fat. Notice on the far left, we see a significant amount of yellow and orange, particularly around the midsection. This represents a higher percentage of body fat. Now, as we move towards the right, you can see a dramatic reduction in the yellow and orange, especially in the abdominal area. This signifies a decrease in overall fat mass. While DEXA can't perfectly isolate visceral fat from the subcutaneous fat, it gives us a strong indication where the how much is the visceral fat. The changes we see, especially in the deeper abdominal areas, very often correspond with a reduction in that dangerous visceral fat. So, a new approach to quantify visceral fat via bioelectrical impedance analysis and ultrasound when we compare it to a MRI scan. So you can see the visceral fat located around the organs. So how does it link to diabetes? So this is a dangerous link of visceral fat to diabetes. You have the environmental factors, the various diets, and very important, the gut microbiota, which we'll talk in detail. Also, genetics has a role to play. And of course, with age, there is increase in the body fat, decrease in uh, the muscle mass. So, why is this hidden fat bad? Unlike other fat, visceral fat pumps out harmful substances. They are inflammatory chemicals and free fatty acids. These chemicals go straight to the liver and make your entire body ignore the hormone insulin. This is called insulin resistance, the major cause of type 2 diabetes. When your body is resistant, your pancreas has to work overtime pumping out more and more insulin to get its job done. Eventually, the pancreas gets exhausted and can't keep up. The blood glucose rises, and that is the direct path to prediabetes and type 2 diabetes. So, reactive oxygen species, pro inflammation, lipotoxicity, all working hand in hand to cause this dysfunction and organelles of adipose tissues, dysfunction organelles of muscles, and this low grade systemic inflammation leading to insulin resistance and type 2 diabetes. When we talk about gut microbiota, why is gut microbiota so important? And what is gut microbiota? So, we need to understand that when we are born, this is the gift that our mother gives us, and she transfers some healthy gut microbiota from our body to our body. So, this is a gift which I tell my patients that your mother gave you when you were being born, and she told you, okay, son or daughter, when you are an adult, these bacteria would number about 150 to 200 trillion in your body, weighing approximately more than 2 kilograms, and they will be responsible for you achieving 100 years. So there will be no diabetes, no hypertension, no coronary artery disease, not even cancer, and no joint aches or hypothyroidism or any other disease. So you'll lead a disease free life. And the role of these gut microbiota, now we are realizing more and more how in every day to day activity, every prevention of every organ damage, they play a very, very crucial role. So, what are we doing in the last 3 generations? We have been, there is no antimicrobial stewardship. So, any fever, any sore throat, any pain abdomen, small injury, dental ache, and we pop in a pill. And what does that pill contain? majority of the time that there will be some antimicrobial antibiotic in that pill, and these antibiotics do not differentiate between good and bad bacteria. So all these gut happy healthy gut microbes are also killed. So that is why that low immunity and early onset of heart disease, early onset of diabetes and hypertension, which we are seeing, and it's more of an epidemic now. So the role of gut microbiota is very, very important. And we are very particular in our prevention program that we explain to the patients that you have to keep these gut microbiota healthy and alive for the rest of your life. So, as far as possible, try not to destroy them. So, like we mentioned earlier, it's not about weight. We may be having a normal weight, but there would be a lot of extra fat around our organs, which is not visible, and it may not lead to that much of weight gain. So you can be thin on the outside, but have a lot of hidden fat on the inside. This is more important for the South Asian phenotype, where we have the lean, thin diabetic patient. So do not trust your weighing scale. The best at home check is a simple tape measure, a waist size over 35 inches, that is 88 centimeter for women, and of 48 inches, that's 102 centimeter for men, is a red flag for high visceral fat. So, second thing that I tell my patients is, I don't need to see your weight, I need to see your weight. So how do I see your weight? I'll measure it with a measuring tape, and I tell them, don't buy a weighing machine, buy a measuring tape. And please check how much of inches have you put in from the time when you were a teenager. That is when your body was fully developed. And after that, how much of inches have you put in? And that will lead to a target of how much of inches you need to lose to stay fit and healthy for the rest of your life. So instead of treatment, we always talk about prevention first. So we have a three-step prevention plan. The good news is that the visceral fat responds incredibly well to lifestyle changes. So whenever I give a talk on management of type 2 diabetes or metabolic disorders, I always say the first important thing is lifestyle changes. The second most important thing is again lifestyle changes. And the third most important thing is again a third time a lifestyle, proper, adequate lifestyle changes. And after that comes the rest. So move with purpose. It's not just about a cardio or strength training or building your muscles. Is critical because muscle helps you body use insulin properly, and visceral fat hates muscle. So you need to look after your muscle mass. So you need to do a lot of resistance training. And second thing is we must stop sugary drinks and processed foods. Sugar is a primary driver of visceral fat. You can't outrun a bad diet. Focus on whole fruits, fiber, and a high protein diet. Third important thing is our own biological rhythm. We need to focus on sleep and stress. High stress means there's a lot of cortisol coming out, and poor sleep, they are direct signals for your body to store more visceral fat, and this is not an option for us. So, visceral adipose tissue, the hidden culprit for type 2 diabetes. Preventing diabetes isn't just about losing weight, it's about losing your hidden visceral fat. And don't focus on the scale, focus on your waistline, building muscle, and eating whole foods. And there are various articles that have proven it. So, this article on visceral adipose tissue is Sneha Dhokte and Zaza. is published in March 24. Visceral adipose tissue, the fat stored deep around the organs, is the primary metabolic driver in the development of type 2 diabetes. We all know that. It argues that the visceral adipose tissue is not merely an energy store, but acts as an endocrine organ that releases various harmful inflammatory factors and free fatty acids. The release of inflammatory molecules, that is adipokines, leads directly to insulin resistance in the liver and muscle tissues, which ultimately results in the failure of the pancreatic beta cells and the clinical manifestations of type 2 diabetes. Therefore, understanding and targeting the visceral adipose tissue is crucial for effective prevention and treatment strategies for type 2 diabetes. And your key to diabetes prevention is losing the fat you can't even see. And key genes also link to higher fat and visceral fat in South Asians, and there are various of these. So there are various, the risk variants are there, quite a few of them, which are linked to high BMI, waist size, skin folds, obesity, type 2 diabetes. And they have very strong evidence in the Southeast and the Asian and the Indian cohorts. And they are also polygenic risk factors. There are various, very small variants of these genes, and various large studies have shown there are millions of variants that the Southeast Asians carry higher genetic risk for obesity and central fat at lower BMI. So, an Indian with a normal BMI and American with a higher BMI, the Indian will most likely will have a higher chances of metabolic disorders because of excess of visceral fat between when you compare the two of them. And type 2 diabetes related loci also seen in the South Asians, not directly fat genes, but they influence metabolic risk. This is a hospital in Haridwar. We have 15 hospitals overall now. And this was last year, uh, a Seva Ankur Bharat. They had 350 volunteer doctors who had come to visit our organization. Thank you so much. We can take questions now.
Thank you, Dr. Shah, for this insightful presentation. We will now open the floor for the Q&A. I request all the attendees to please share their questions in the chat box, and we'll try to take as many as possible, although it is already overflowing with questions as I can see. But, sir, since it's not every day that we get an opportunity to interact with you, I would like to begin with a few questions of my own.
Sure.
Uh, so one would be, do you think there's a genetic component that makes some people more have storing more visceral fat than others?
Very true. This is what I was telling when I was concluding the slides, that there is definitely, it's now been proven without doubt that there is a definite genetic component. And when we go in details, there are various variants. So it's a long genetic code which are linked to higher BMI, waist size, skin fold, obesity, and type 2 diabetes. And this has been the very, very strong evidence, especially in the Indian and the South Asian cohorts. And there have been other genes which have been associated with central fat, weight circumference, the MIC4R gene, and the FTO. These are the various genes that have been responsible for this excess of visceral fat in our body. And more are being discovered. There's a whole list of them, and they are not necessarily fat genes, but high metabolic risk genes. And there's again a very, if you go into details, we have lots of them. They are numerically named, but uh, there are quite a few of them.
And what would some early warning signs or symptoms be for a person so that he's aware that he might have a risk of having a higher visceral fat?
So waist circumference, BMI, and because we can't get an DEXA scan or a MRI or a CT scan for determining fat, but we are the basic thing is a measuring tape and see how much of inches are you putting in from when you were a teenager. This is a mandatory for all our patients. We tell them you have to have a measuring tape at home, and please note down everybody's, like, you take your height every year and you have a chart at home and you see how much of height your child is putting on. You also measure how much of waist circumference your child is putting on. That indirectly also comes from frequently the changing girth of your trousers or your skirt, where the as you put on more and more fat, you will have to keep on changing your jeans or your trousers, and they will be a tighter fit. So you will realize that you are putting on inches around your waist, which is a sign that visceral fat is you're gaining visceral fat.
Okay, so now I'll take some questions from the audience. So we have a question from Neha Bhandari. She asks whether is apple cider vinegar helpful to manage visceral fat?
So a lot of trials again, and what we need to do is lead a healthy life and metabolically be very active. So apple cider vinegar people have been trying for last so many years. And apart from apple cider vinegar, your calorie intake is very, very important. And it has a very small role, apple cider, but not a major role on the body fat. Uh, and the evidence for visceral fat reduction has been very, very weak and not all that consistent. And there have been, especially from Japan, there have been controlled trials where 1 to 2 kg body weight has been seen in, say, 12 weeks with daily apple cider vinegar, and mostly due to the reduced appetite and slightly better blood glucose control. So this small difference reduction in the waist circumference, but they do not directly prove that there has been significant visceral fat loss. So we still do not have a very high quality meta-analysis showing that you have enough data that apple cider vinegar will decrease the visceral fat also, apart from just fat reduction. And then we also have the placebo effect. When you believe in something, I am a very strong believer of this. If you tell your body every day that I need to lose weight, you will achieve it. You will achieve that target. So a positive mindset is very, very, very important. We all must realize this, that we need to have a very, very positive mindset. And we've seen uncontrolled diabetics, patients with complications, with nephropathies, with cardiac failures, even advanced cancers going into remission. So this, apart from that sleep that I mentioned at the end, you need to have a very, very positive mindset. That's very, very crucial for a healthy long life. Those happy hormones that we were discussing, they needs to be, we need to keep, releasing happy hormones and stay fit and happy and keep everybody around you fit.
Okay,
It
so
should be like that. Yeah.
moving to the next question. Aerobic versus anaerobic exercises for reducing visceral fat. Which do you think is more effective in terms of burning visceral fat?
So a combination of both is very, very important. So aerobic exercises like walking, jogging, cycling, high intensity training, they are most proven for visceral reducing visceral fat. Agreed. And meta-analysis also show moderate, high volume aerobic exercises consistently reduce visceral fat even without major weight loss. This is very, very important. You may not lose so much of weight, but visceral fat with aerobic exercises, yes, definitely. And mechanisms that there's a higher calorie burn, there is improved insulin sensitivity, and there is increase in the fat oxidation. Whereas anaerobic exercises like resistance training, weights, machines, body weight lifting, they also reduce the visceral fat, but effect is smaller than aerobic exercises alone, and work best when we combine the two. Both aerobic and anaerobic should be combined, but aerobic exercise definitely will work faster and better. So, aerobic versus anaerobic for direct VAT reduction, and combination either alone for best metabolic results.
Okay, sir. Moving on to the next question. What about the use of probiotic products like Yakult or cranberry juice or cinnamon? Do they help?
So, very nice question. I mentioned prevention. So, in the last 30 years, I must be one of the very few doctors who we do not use antimicrobials left, right, and center. Only when absolutely required. That is in a very small percentage of patients. And if you manage to keep your own gut microbiota healthy, you would not depend on outside probiotics to keep you healthy or replace what you have already lost. So try not to lose your healthy microbiota. So there are some strains which show small reductions in abnormal fat. So they are definitely they will have a role to play in keeping us healthy, because most of us have been using antimicrobials for some reason or the other. You have fever and you use antimicrobial, you have dental pain, you are prescribed an antibiotic, you have tummy aches or loose motions, again you are prescribed antibiotic. There are methods where you can avoid these, but that would, I believe, maybe we can have a separate discussion. It'll be another an hour long discussion on gut health and use of pro and prebiotics and how to maintain a healthy, happy life, preserving your own gut microbiota without having to consume from outside. But definitely, because most of us are deficient in gut microbiota, we would these will be helpful for us. Definitely, all of them, all. Any any food which is fermented, any food which is fermented is good for us. And over the centuries, humans have used fermented food in all cultures. There are different varieties everywhere. Again, a long list.
So, most of the clinicians that I have interacted with do not mention much about preventive healthcare. So, I mean, I just feel so lucky to be hearing your words and you putting a lot of focus on the preventive healthcare. So, thank you for that. And I'll move to the next question. So, fatty liver can increase risk of diabetes, and diabetes increases the risk of fatty liver. So, which do you think is more serious, and how can they be managed?
So definitely diabetes is not a single disease. I do not even call it a disease. I've even stopped calling myself a doctor. I tell them I'm just your guide for health. I'm your guide. I'm your margdarshak. I tell my patient, don't call me a doctor. And don't call diabetes a disease. It's a lifestyle disorder. Whether it is diabetes or hypertension or heart disease or fatty liver or obesity, they are all lifestyle disorders which we have seen, irrespective of what people claim that this, whenever I come across various studies where they say that this drug caused this much of weight loss, I said, where is the lifestyle component? How much did the patient lose just because of lifestyle also? Because we've seen majority of our patients easily can lose 10% of the body weight just by lifestyle. So that's a very significant part. So fatty liver, diabetes go hand in hand, and both are bad for us, but both can be prevented and both are manageable. So catch them on time. Tomorrow we are going to have a fibro scan in a in our hospital. So making people aware. We'll have week long diabetes day, something or the other, a walk, a run in the morning, yoga sessions, and tomorrow we are going to have a fibroscan estimation of our patients to make them aware about fatty liver and how bad is it, what are the different stages, and how it can be prevented. And at majority of those stages, it can be prevented. So earlier you catch it, the better it is for you.
Okay, so moving on to the next question. Can we remove visceral fat through homeopathy or just allopathy is the answer?
So lifestyle is not homeopathy or lifestyle is not allopathy, lifestyle is not Ayurveda. So we've been discussing about lifestyle. That is your way of life that every human on earth should follow an appropriate and adequate lifestyle. So if whatever is missing or whatever is in excess, it has to be checked or improved. So, lifestyle does not belong to any pathy. Lifestyle is your own, it is part of your own daily routine. So, the main thing is that you have to have a reduction in the calorie intake, and plus you have to have adequate exercises, which includes both aerobic and aerobic. Resistance training is equally important, especially in the people who are above 50, because sarcopenia sets in where you start losing a bit of your protein, muscle mass every year. So that is why the muscles support the bony frame. So that becomes weaker. So we become more prone to fractures, we become weaker. So to prevent that, and you have people who are at 100 and still running a marathon. So they look after the body well. They prevent muscle loss. So there are various methods how we should do it, and we can all do it. It is easily achievable. What we are talking here, everything is achievable. Every person on earth can live a happy, healthy life well beyond the 80s. We retire when we say we have crossed 60 and we say we have retired. And my message to all my patients, we tell them every day that you are young till 80. You should not retire till you are 80 years of age. And then I tell them, those patients who come to me at the age of 80, I'll tell them, you will grow old at 90. You are still young. And those who come at 90, I'll tell them, you are going to go old at 100. So not at 90. So I keep increasing the target of old age. So one should never go old. You should stay healthy and happy.
Okay, so
Otherwise, we are all beyond, retirement ages, and we are active and healthy.
so true, sir. Given the time constraints, we'll just take two more
Sure.
questions and then we'll move towards the closing. So, one question would be, can hormonal issues like PCOD or thyroid make visceral fat worse?
Another very, very important. And most of us do come to us, especially the young girls having PCOD. It does cause a lot of hormonal disturbances, and it is a vicious cycle. You keep adding weight, and your PCOD worsens. You have to break that cycle. Thyroid again, a long, long discussion, because it'll be an eye opener for you all. Uh, when I tell you, or when our audience realizes that most of them who are on thyroxine, which is a thyroid hormone, and T4 to be exact, when we measure thyroid hormones, it's T3 and T4. T3 is the active variant. T4 is the tablet that is available in our country. Outside, we have both T3 and T4 available. T4 converts to T3 in the body. But we are obsessed with TSH. It's not a thyroid hormone. It's a hormone which is secreted from your pituitary, controls the thyroid gland, and any slight increase in TSH makes us believe that we have got a thyroid disease and makes us start on a T4 regime. We start taking T4 when our T4 is normal and just our TSH is high. TSH is very, very important if you're planning pregnancy or if you're pregnant. Then TSH has to be half of normal. Otherwise, the International Thyroid Society has its guidelines, which earlier used to say that till 10, if you do not have any symptoms, no need to start thyroxine T4. Now it has gone up to 15. Discussion is upon individual doctors and what the clinical effects are. So 15 TSS also we may not start a thyroxine, that is a T4. So most of us, we come to in our own daily clinical practice, most of our patients tell us, oh, I've got a thyroid for the last 10 years, 15 years, 5 years, and I'm on so much power of thyroxine. And what was wrong? My TSH used to be high. So out of 1,000 patients we see of who are on thyroxine or T4 or a thyroid pill, majority, more than 70%, have just had an increase in the TSH with normal T4. Another topic to be discussed in details, maybe later on, very, very important. So, PCOD, like we were saying, it does increase visceral fat, and how it increases, there is a very high insulin levels, which leads to because of insulin resistance, and it pushes fat storage into the abdomen. And also the higher androgens in PCOD promotes central visceral oblique visceral fat pattern, and even normal weight PCOS women often have higher visceral fat than controls. This is also very, very important. When we check their visceral fat, they'll have more visceral fat than a non-PCOS lady.
Okay, so moving on to the last question for the session. Guide for keto diet in prevention and management of diabetes.
So various diets over the last so many decades. So a higher protein diet is what people always advocate. So you should have more. See, the main culprit we must realize is carbohydrate. It's not fat in a diet. It is the carbs that we take, especially in the Indian subgroup. We take everything is carbs that we consume, and we take lesser of fruits and vegetables, and the protein that we are consuming are pulses. And it should be an eye opener to all your audience that pulses contain approximately 50% carbs again. So pulses are not 100% protein. We must realize this. Another discussion, a diet which is happy, healthy diet, which is rich in proteins, would take another hour to discuss. But all these crash diets, again, they will work till you are on that diet. The day you stop your dietary intervention, you regain your weight. Same as with all these, nobody, I don't think anybody asks us about the newer weight loss injectables. They are there in each and every WhatsApp group. Tirzepatide versus semaglutide, which to take, how much to take, when not to take. My take home message would be whenever we use any weight loss medication, it will decrease your fat, also decrease 10% of your muscle. And the day you stop that medication, 100% of fat will increase. You will be deficient in the muscle. You will not regain your muscle. Muscle regain, you have to do resistance exercises. So, a high protein diet, which for us Indians, we always believe that just taking dal is a high protein diet. We have to we have to be that dal pulses do contain a lot of proteins, but they are not 100% protein. They also contain carbs. So apart from that, grains would contain mostly carbs, but also a bit of protein depending what grain you are taking. So they'll contain a lot of fiber also depending what grain you are taking. And they also have gluten, which we do not advise. Some of them would have a high gluten. So gluten will again cause a lot of inflammation. So here we are talking about inflammation, we are talking about genes, we are talking about lifestyles. So everything has to be balanced. Very, very important. So it is very easy to reach a nice, healthy age without any disease. Target is do not have any disease. We are talking about diabetes, okay. But apart from diabetes, interrelated with diabetes, heart failure, renal failure, neuropathies, retinopathies, eye problems, nerves problems. You should not have any of these. That's very, very important. And adequate diet and exercise and sleep and meditation and yoga, pranayam, the combination would keep you fit for a very, very long time, maybe beyond 100 years.
I think those are very important points made by you, sir. And with this, I would like to extend my heartfelt thanks to you for joining us today and sharing your valuable insights on visceral fat, diabetes, and weight management, including diet also. So, your expertise has truly helped us understand how small lifestyle choices can create a big impact on our long term health. A special note of gratitude to Dr. Rajendra Pratap Gupta for taking out his time from the busy schedule and joining us all the way from Germany. Thank you, sir, for your constant guidance and support. We encourage all our participants to download the Health Parliament app and the Patients Union app to stay informed, engaged, and connected with a community that prioritizes health and patient empowerment. The links are available in the chat box. Thank you to each one of you for your active participation and a thoughtful engagement throughout the session. Wishing you all good health, safety, and a wonderful weekend ahead. Thank you once again. Thank you, sir.
Thank you. Thank you so much. Thank you all.
Thank you.